Welcome to Current Affairs. Tonight, we turn to a story of neglect. Australians have been warned to have regular eye checks for years now, but little has changed in people's attitudes to take care of their eyes. In the upcoming interview with two leading Australian optometrists, we'll delve deeper into how underlying health conditions can lead to vision loss, and how optometrists are crucial in detecting the systemic disease manifesting in the eye.
Nathan, thank you for taking the time to be with us today. I understand you have been doing some research on diabetes. Could you give us some more background on your work?
Thank you. It's a pleasure to be here today. One of the main areas of my work includes investigating eye conditions and finding the causes of ocular diseases and their association with systemic disease. So systemic diseases are ones that can affect your organs, your tissues, or even your whole body. In my work, I use a range of instruments and techniques to detect ocular signs of disease, which may be systemic in nature. After diagnosis, I also am responsible for coming up with the appropriate eye care plan or referral to other healthcare specialists who may be able to provide necessary treatment. One case I dealt with concerns an elderly gentleman who was diagnosed with prediabetes. We can call him Martin. His vision became increasingly blurry over the span of 6 months, even though he had just gotten a new pair of glasses. In his case, after conducting eye exams, I concluded that his diabetes was reducing the blood supply to the vessels on his retina, which led to his vision loss. I immediately referred him to his GP, who prescribed him medication to lower his blood glucose level. Now, his vision is steady, so he spends his time kicking around balls with his grandson whenever he can.
That's incredible how your work goes beyond just being able to diagnose eye conditions. What techniques are involved in detecting diabetes in your patients?
So patients who experience vision loss as a result of their diabetes suffer a condition called diabetic retinopathy. I start with checking the patient's visual acuity, meaning their ability to resolve the fine detail. I measure both distance and near visual acuity by using charts placed at approximately 6 meters and 40 centimeters away from the patient respectively. If there is suddenly acute reduction of vision in either eye, then this suggests that I make an immediate referral to the ophthalmologist. I first dilate the pupils to allow more light to enter. Afterwards, I use a slit lamp to look at the back surface of the interior eye called the fundus. I then look at the disc and work my way along major blood vessels. In my examination, I note any little red dots, which may be small hemorrhages or aneurysms, which is the swelling of a blood vessel. When I was looking at Martin's retina, I could see floating cream spots and fatty deposits. The combination of bleeding vessels and faded spots strongly suggested diabetic retinopathy. His medical history of prediabetes further confirmed his eye diagnosis. Overall, a detailed look at the images of the health of Martin's retina allowed us to diagnose him with diabetic retinopathy. I'm just relieved that his condition was mild and that he is recovering well.
Fascinating. It's incredible how digital imaging of the interior eye helps Martin regain his vision. That concludes our first segment of interviews. Thank you for your time today, Nathan. Welcome, Jimmy. It's lovely to have you here with us today. What has been your experience of diagnosing systematic disease?
One of the most common eye conditions I've come across is one called anterior uveitis, which is the inflammation of the iris and ciliary body. In contrast to how Nathan uses a slit lamp to examine the posterior eye, I use the same instrument to focus on the anterior chamber of the eye, which lies in between the iris and the surface of the cornea. I focus a bright, narrow slit of light into the patient's dilated pupil. And when looking through the microscope, I watch out for any cells or protein flares in the thin layer of fluid that fills the anterior chamber called the aqueous humor, which is diagnostic of anterior uveitis. In regard to systemic diagnosis, uveitis has a strong association with inflammatory disease. Specifically, anterior uveitis is one of the most common manifestations of rheumatic diseases, which are inflammatory diseases that cause the immune system to attack joints, muscles, bones, and organs. For patients diagnosed with uveitis, it is essential that I work closely with other doctors to provide a precise diagnosis. They then conduct a physical examination to look for systemic inflammation disease associated with uveitis. And in conclusion, optometrists help to detect systemic disease by recognizing associated ocular signs of diseases and drawing upon the experience of other doctors in providing a diagnosis and coming up with an appropriate treatment plan.
I can see how important your work is to help people receive the correct treatment for their eye conditions.
Tonight, we were able to hear from two leading Australian optometrists speak about how their work detecting systemic disease from ocular symptoms could potentially change the course of people's lives, like Martin. That concludes our special edition of Current Affairs. Thank you and good night.